Hello, hi, my name is Austin. Again, today I've come to talk about yeast infections, recurrent yeast infections. So what are yeast infections? What is a recurrent yeast infection? It is an infection that is reappearing more than one time in a period of 6 months. So what are the causes of recurrent yeast infections? One, let me talk about increased weight, being overweight. So what happens when you're overweight? When you're overweight, your sugars, your body usually loads a lot of sugars in your cells. Okay? When you are loading a lot of sugars in your cells, you are feeding the fungus in the vagina or in the point of infection. In this case, we're talking about vaginal yeast infections. So when you're overweight and your sugars are being lodged into the cells, you're feeding the sugars. Remember, how does the yeast infection occur in the body? It is a normal flora. It's not like yeast infection usually comes out from somewhere else. No, it is a normal flora in your GI, in your vagina. It occurs naturally there. It is placed there to perform a certain function. It's a symbiotic function between your body and the fungus. And some people usually talk about fungus, yeast infection being sexually transmitted infection. No, it is not categorized among the sexual transmitted infections. No, this is why we are talking about the fungi in your vagina being a normal flora. And you being overweight is what is feeding the fungus in your vagina, causing an overpopulation of the fungi in your vagina. So this overpopulation is the one that is causing yeast infection. The next cause of the recurrent yeast infection is a high antibiotic therapy. When you're from using the antibiotics from a longer period of time, you usually render your body, the antibiotics usually kill also the normal flora, not just the antibiotics. And when you're killing the normal flora, you are affecting the normal functioning of your vagina. The pH goes down, the functioning of the normal flora goes. To some point, the fungus usually protects your vagina from infection because it is a symbiotic relationship, all right? And the next thing is the using of hormonal contraceptives. Anytime that you're using hormonal contraceptives, it affects the body's immunity. And when the immunity goes down, it renders your body weak. So any microorganism, whether it's the normal flora in your body or an external microorganism, it will cause an infection in your body. In this case, when the population of the fungi, of the fungus, the yeast in your body increases, it will cause some dryness in your skin, mostly in the labia majoris, the outer lips, alright? They will dry up, you'll feel itchy, you'll scratch them, you'll cause a cracking, and you will introduce the fungi into the skin, causing pain, swellings. In some cases, you get the discharge, alright? Higher. The next thing is what you're feeding on your diet. When you're eating a lot of sugars, a lot of wheat, ice creams, yogurts, ugali unakula kila wakati, mchele kila wakati, such meals, alright? When you're taking, the intake of sugars is very high, you are also increasing the lodging of sugars into your cells, feeding the fungi. Remember, the fungi feeds on sugar. So you are the one feeding the fungus. Don't go saying and accusing maybe your spouse, probably your husband, because you're getting recurrent yeast infections. No, remember, they're not sexually transmitted infections. So how do you deal with such recurrent yeast infections? One, reduce the sugar intake. All right, reduce the yogurts, reduce the wheat, reduce the ice creams, all those. All right. Secondly, lose weight. If you're overweight, if you're obese, lose weight. Remember, most people usually associate being overweight, being, let me use fat, with poor hygiene, because there is sweating, there is dampness within your vagina, all right? All those are environments that increase the multiplying of the fungi. Next thing is practice fasting. If you're eating fast, right, it resets your body. Next thing is, maybe this is a tip that I would maybe give you guys, it might help you. Try putting some salt into your water. This increases it concentrates your urine, increasing the pH within your urethra. When your pH is slightly acidic, it doesn't allow microorganisms to grow within your private areas. So take some little water, increase your pH within your urethra, and hope this helps you.